All right, hello everybody. My name is Zach. Welcome to another video of the High Yield Concepts in Radiology course. We are going to be talking about the basic modalities of imaging in today's video. So the first is the X-ray. We all have seen X-rays used. This is where we shoot an X-ray beam through a patient and there is a film behind them. And based on the different densities of structures, we will have different appearances of these different structures on the film. So gas and air will show up as black and your bone will show up as white. And because your bone is the most dense structure, it's going to absorb most X-rays. And then in between those fat and soft tissues will show up as a gray, black to gray. So X-rays are used for so many different things, but most commonly they're used for bone fractures, ruling out things like pneumonia or pneumoperitoneum. And the terminology we use for X-rays are radiolucent and radioopaque. So radiolucent would be referring to things that are black on the film, so such as air and gas, and then radioopaque for things such as bone that show up as white. And so here's an example of an X-ray. So what we're going to do is actually use this 60-year-old patient with back pain as our sample case to go through all these different imaging modalities to highlight the different strengths and weaknesses and uses of these different tests. So X-rays are widely available. We have portable machines now that we can actually roll into the ED rooms to take X-rays of patients. And X-rays are best for looking at bones. They have limited soft tissue detail. And so as you can see with this lateral film in the lumbar spine here, we can see that there's no acute fracture, but we do see some narrowed joint space and some end plate irregularity, but we really don't have a great idea of what's going on with the soft tissues around the vertebrae. So that moves to the CT scan, computerized tomography. This is basically a fancy X-ray where we shoot X-ray beams in 360 degrees around the patient, and we can do that in various planes and axes. And tissues will appear similar as they do on an X-ray because this is the same X-ray ionizing beam. And so this is often used for traumas, characterizing cancer pathologies, and looking at vascular disease, so such as pulmonary emboli, things like that. The terminology of CT scans is based on the Hounsfield unit. So this is where we set water as 0, and then anything more dense than water will show up as a positive Hounsfield unit, such as bone, which will show up in about 400 to 600 Hounsfield units. And then anything less dense than water will show up in the negative Hounsfield unit range. And this is important because we can use this concept of windowing where we can narrow and set a optimal range of Hounsfield units to give us the most optimal window for looking at certain tissues, such as a lung window or a bone window. Now, our terminology with CT scans is density. So things that show up white, like bone, will be hyperdense. Things that show up dark, like gas, will be hypodense. And then it's important to understand the concept of enhancement. So we can actually give patients contrast, and that contrast will go into their vascular tissues, and we will be able to then have a better distinguishment between that contrast and surrounding structures. So here's an example of a CT scan lateral lumbar spine image like we saw on the X-ray. We see that we have pretty good resolution here. It's better than the X-ray, but it's still not perfect. It's not outstanding. And we do have a greater risk of radiation or a greater amount of radiation that the patient is exposed to with the CT scan. So that's something to consider when ordering these. So if we look at our 60-year-old with back pain, we see there's still some bony irregularity here. We see some more sclerotic end plate changes and irregularity. This suggests that there's probably some type of infectious or inflammatory process going on. But again, we still have limited soft tissue visualization. And so then we move to MRI. So this is unique in that we're actually not using ionizing radiation for our magnetic resonance imaging. It uses a magnetic field and radio waves to actually alter the hydrogen atoms in different tissues. And so we use MRI for things like brain imaging, looking at multiple sclerosis or strokes. And it gives us really good visualization of the spinal cord. So we can look at spinal disorders, tumors. And your musculoskeletal radiologists love this modality to look at things like joint or tendon injuries in the shoulders or knees, for example. And the terminology we use for MRI is intensity. So things showing up bright will be hyper intense. Things showing up dark will be hypo intense. And then you'll see a lot of different sequences of MRI. So things like T1, T2, DWI. We can talk about those in another video. And so you see with this image here, MRI gives you the best soft tissue visualization that we've seen so far. It's pretty amazing resolution what it can do, but the MRI scans are time consuming and expensive, and there are certain contraindications or complications. For example, patients with pacemakers, you have to consider special precautions for them. So sticking with our 60-year-old patient here, we now see that there is actually a peripherally enhancing epidural collection, most concerning for an abscess. And again, we wouldn't have been able to tell this from the X-ray or CT scans. And so if we take an axial MRI of the same patient, we can also see that we have some more peripherally enhancing multiloculated lesions on each side of the vertebrae, most likely some paraspinal abscesses as well. So we consider those two MRI slices here, we get an overall impression that this patient likely has some discitis and osteomyelitis with epidural and paraspinal abscesses. So moving on to ultrasound, this is our last modality of the video. This is a unique modality in that it uses sound waves and shoots them at structures, and then based on what sound waves bounce back to the probe, we can get a visualization of these different structures. And so we often use ultrasound for gallbladder pathologies, breast masses, thyroid nodules, and you can actually look at vascular flow as well. There's a Doppler mode on the ultrasound machine where you'll see red and blue colors, red meaning blood's flowing towards the probe, blue meaning flowing away. And ultrasound is great in the sense that it's dynamic, so we can actually use it to guide procedures such as biopsies or obtaining IV access. When we describe ultrasound images, we use echoic, so bright things are hyperechoic, dark things are hypoechoic. And then acoustic shadowing is important to understand. So sometimes a structure can totally reflect all of the sound waves to where all of the structures behind that item or structure will not have any view. We won't be able to view, so that our view will be obscured. And so you can see here, again, ultrasound is dynamic, it's non-ionizing. The big negative of it is it's pretty low resolution and it's very operator dependent. And so there are a lot of settings on the ultrasound machine, such as the gain and frequency and depth, that you have to have a lot of experience and technique to obtain the most optimal images. And so as you can see from this image, we have a hypoechoic collection. This is probably an abscess. And as you see in this next image, we have a hyperechoic linear structure. And this is actually in the left index finger, likely representing a retained foreign body, so like a splinter that may need to be removed. And so that's the end of the video. I hope that gave you guys a good sense of what these different modalities are used for, and hopefully can help you to describe your findings on these modalities. So hope this video was helpful, and we'll see you guys in the next one.